Hello, everyone. Welcome to today's NJHFMA webinar. And it's about cybersecurity updates from the experts. Today, we're joined by an interesting trio of panelists from different types of organizations, like an FQHC, a health system, and also a community type organization that helps folks in the community. So we have Paul Garin here today, who is the CIO at Urban Health in the Bronx. Let me just bring back my thing here. Okay. So he's CIO at Urban Health Plan in the Bronx. He has over 30 years of accumulated experience in the financial and healthcare technology space, serving in various management capacities from C-level and VP, focusing on information technology in the medium to large ambulatory hospital and healthcare systems. We have Robert Babin, second, Director of Strategic Initiatives and CISO at St. Peter's Healthcare System in New Brunswick. Bob has over 35 years of experience in manufacturing, financial, and healthcare technology, serving in various management capacities, including Director, Senior Vice President, and C-level, bringing strategic experience to information technology and operations. And we have Jason Tahaney, who will go third. He's the Director of IT at Community Options. Community Options is a nationally based nonprofit organization that believes in every person's dignity and in the freedom of all people to experience the highest degree of self-determination. Following this philosophy, Community Options provides housing and employment opportunities for people with disabilities. I'm your moderator. My name is Jerry Blass. I'm the CEO of Comply Assistant. Normal administration is that everyone's on mute, all the attendees. You can type questions into the question tab on your panel. We'll be monitoring those, and we'll be covering those questions at the end of all three presentations. So feel free to add questions. And we're also going to have polling questions, 2 polling questions per presentation. So please be sure to vote during those polls. And we're going to go about an hour. We could go longer if needed, but figure 45 minutes total for the presentations and about 15 for Q&A, and we'll go from there. So with no further ado, I'm going to turn it over to Paul.
Good afternoon, everyone. My name is Paul Garin. A little bit about my organization. Urban Health Plan is an organization that runs FQHCs throughout New York City. In addition to that, we manage the WIC program for New York City as well, and we have a couple other outpatient solutions that we take care of. EMR that we run is eClinical, and it does everything for us from pre-registration to dropping the bill. The COVID disaster, as I call it, hit everybody hard, and it kept us quite busy. We had to send 320 people home who were going to become remote workers, yet we had to keep our sites up and running where we could do that to still service the people of New York City. The big picture in the world stage, as we learned during COVID, is that every healthcare organization was trying to be targeted by these, I call them the bad people out there in the world. Examples of this: when COVID hit in March 2020, the Czech Republic ransomware hit the Brno University as one of the 20 the COVID testing laboratories in their country. It forced them to shut down the entire IT network. Again, in March 2020 in the UK, the Maze ransomware group had published personal and medical details of thousands of former patients at this hospital, medical research company. That was big. That hit the papers. In France, it was a denial of service. It was issued to hospitals in Paris, who were playing an important role in fighting COVID. So, as I say, the criminals were out there trying to cause more havoc than the disease itself. In the United States, the Department of Health and Human Services, dealing with COVID issues, were targeted by many denial of service attacks. This is where they just hit your server so hard that they won't work any further. Phishing problems happened in Taiwan and in Germany. June 2020, the University of California, which was working on COVID-19 vaccine, was targeted by ransomware, and they paid $1.14 million to cybersecurity criminals called the Networker 2021 in June 2020. Canada also had ransomware issues. So it was pretty bad out there. Back in my organization, we had challenges. Again, we had 1,200 employees, 320 we determined overnight who are going to be sent home per the governor's mandate. We kept our clinicians and all their support staff at our sites to treat patients, but the non-clinical folks such as finance, help desk, IT, and a couple other areas, we sent them home. This caused a cybersecurity nightmare for us. My CISO, who is really good at what he does, was not happy with the changes I put in place. In the next few slides, I'll take you through lessons learned and the internal, external cybersecurity risks that I personally had to cause to keep the joint running, as they say. One thing we needed is we needed to communicate, and telephones just weren't the only way to do it. So in order to let this happen, I opened up email for everybody. We had it kind of locked down before that. There's a product with Microsoft Exchange that's called Webmail. We had it locked down. I opened it up so that everyone can communicate inside and outside the organization. My CISO went crazy about that. He said, "You don't understand what's happening, what's going to cause all kinds of issues." I said, "I understand. I agree with you. But of course, we have to do that." And every day I was getting articles back from my CISO about the bad guys are stepping up their efforts and taking advantage of organizations worldwide. It's a challenge that you have to give. I call it checks and balances, but for the organization, I decided that we're going to do this. Polling question. Did your organization increase cybersecurity coverage during the pandemic crisis?
Right, so let me bring that up.
I'm going to give you a minute.
Everyone has an opportunity to answer that poll. Collecting responses right now. Okay, so now I'm going to close the poll. And I'll share the results right now so you can see it. There we go.
Great.
Okay. Any comments on that, Paul, or just move ahead?
I will. You'll see in my presentation, we also increased our cybersecurity. It's
Okay.
so funny because every couple of months now, my CEO asks me, "Paul, are we spending enough on cybersecurity?" Which is a great thing that your CEO is in tune with the what's happening in the world when it comes to their technology. And I said, "This is great." I said, "I think we're okay. If I need more money, I'll ask you for it." Okay. I'm going to take you through. Here's what we did to create cybersecurity risk and with a remote workforce and how we alleviate those self-inflicted risks. I personally say that if there was an issue with cybersecurity, I'm taking the hit for it and I'm the one to blame for it because my CISO is on top of me all the time saying, but sir, you can't do, you shouldn't do that. We shouldn't do that. And I say, I understand that, but the organization still has to function. And that's what I did. So as I mentioned earlier, I granted access to Microsoft Outlook webmail to all employees from any device. My CISO obviously was not happy about that. But after we did that, we both came up with a solution. We implemented a two-factor authentication access to our network for all non-corporate devices. So if you were logging in on your personal device to get to email, be it your cell phone or your personal laptop, you had to authenticate to prove who you were. The other thing we did is we did lockdown access so that if it's coming from a network that was outside of the United States, it was not going to work. We locked that down. We used your IP address location to verify that you were coming in from at least within the United States. So that seemed to be okay. As we rolled out home access for people, employees started requesting access for printers and fax machines. My folks were going nuts saying we shouldn't be doing that. I agreed with them. We came up with the solution that we installed Adobe Acrobat. We taught them how to interact with documents only via PDFs. So that seemed to go okay. No one was issued a printer or a fax at home. Hello, mouse. Jerry, it's not.
You don't have
Jerry,
it?
it's not allowing me to change
You
it.
should have it.
Okay. It's making it smaller. Let's try one more thing. No. Can you just change it?
No.
Take the next slide.
Yeah. There we go.
Thank you. Another item, the clinicians needed a way to have patients sign consent forms. So overnight, we implemented PandaDoc and DocuSign. The reason why we did both is DocuSign is a great product, but their pricing was very high. So we came up with another alternative, which was a PandaDoc solution, which worked well. Everyone picked up on it, and the whole organization now uses one or the other without any issues. Again, I touched on this before. Our cybersecurity policy, when I reviewed it, was not where it should be. So I upped our policies, liabilities, and coverage. CISO totally agreed with me. We looked at the numbers, and we said that the average ransomware for our size organization was about $4 million. So we upped it to 5 just to be safe. Next slide. The problem also, as I mentioned earlier, the bad guys were stepping up their hacking, especially phishing. So we increased our phishing campaigns. We used strong secure access to our network. I mentioned earlier, we do a factor authentication. Also, users must either use LogMeIn access, which is old but reliable technology where you basically use your computer at home as a terminal to access the workstation in the office. We issued Sophos Red Boxes, which is a secure VPN connection from employees' homes if they really needed to get directly into our network. We issued the computers and locked that down as well. Next slide, please.
Is that it, Paul?
I don't know. I can't get to the next slide.
This isn't it?
No, next one. There we go. Polling question. Did your
Okay.
organization experience any security breaches during the pandemic crisis?
Okay, we're gonna launch that poll. There it is. Give some time here. And let's see, I think I can now close it and then share the results. And there we go.
Interesting.
Yeah.
Thank you for sharing that information with us.
Okay, so we'll go to the next slide.
Yep. Okay. I'll give you a quick report card that went on while we were during the pandemic. People were taken advantage of. My organization did not directly have a security breach. However, we were quite lucky that we had the 0-day breach, which everyone had. That's where Microsoft had a security leak and your credentials from your Active Directories and also your email logins were open to the world. That was a Microsoft issue. They did fix it. However, we had, based on what we saw, our information was released. So we did force everybody to change all their passwords. I just said a global password change for every system to be safe. We did not experience, to my knowledge, anybody getting into our systems, but that was just a security feature that I wanted taken care of. The organization didn't have any issues with that. I did not hear any negative comments back from my clinicians, their support staff, or our ancillary departments as well. We just did it, and that worked out fine. Jerry, that's where I am. I'm done with my presentation. I'm going to pass it on to Bob now. Thank you very much, guys.
Okay, so let me escape here. Let me just go. And I'll get Bob's presentation going here. And we'll go back to the top. and make it a full screen. Okay, Bob.
All right. Hello, everyone. Glad to be here today. And thanks for giving us this time to share our experiences with COVID-19 with you. Although it's not something that we like to talk about too much, the pandemic has not been kind. The pandemic has certainly disrupted virtually all industries, but none more than healthcare. The wrath of COVID-19 has brought to light the need to plan for continuity and recovery. And it has exposed a widespread dependence on and common weaknesses with our third-party relationships. Next slide, Jerry. The cybersecurity journey is about security risk management. Our mission imperative is to safeguard regulated information and/or data from potential cyber harm. Here's a simple risk management formula to remember. The more technology and operational complexities in place, coupled with a greater reliance on third parties, will yield to greater opportunities for cyber criminals to breach us through our third parties, the next weakest link in the cyber breach continuum. Starting today, you should commit to redirecting your focus to third-party risk management in order to ensure the protection of your information systems asset and to better defend yourselves against cyber threats. Next slide, please. Next slide, Jerry. Thank you. Let me clarify what I believe third parties should be defined as. Go up one, Jerry.
Go up one?
Yep.
Okay, you mean this way?
No, there we, no, go up. It's the second, it's the third slide in. It says
This
trust
one?
but verify on. There we go. Thank you.
Okay. That's where
All
I
right.
was before. Okay.
Let me clarify what I believe third parties should be defined as. Any individual and/or company that has a relationship with the enterprise that requires sending, receiving, accessing, storing regulated information on your enterprise network and systems, or using your enterprise computing resources and/or hosting or housing your enterprise regulated information. Those are a lot of words. I'll put it simply. They're not considered employees of your organization. The risk posed by each third party is based on different levels of data types, flows, and/or systems access, which can range from a low to high risk. Next slide, please. There we go. Thank you, Jerry.
Okay.
Here's a sampling of some of the largest healthcare data breaches in 2020. More large healthcare data breaches were reported in 2020 than in any other year. During the wrath of COVID-19, 642 large data breaches were reported by healthcare providers, health plans, healthcare clearinghouses, and business associates. Overall, the year 2020 saw more than 29 million healthcare records breached. And incidentally, one breach involved more than 10 million records. Please take note of the 3 stars associated with the covered entities in this slide. Next slide, please, Chair. The largest healthcare data breach was a ransomware attack on the cloud service provider, Blackbaud. The actual number of records exposed and obtained by the hackers has not been made public. But more than 100 of Blackbaud's healthcare clients were affected, and more than 10 million records are known to have been compromised. The breach does not appear in the OCR breach portal, as each affected entity has reported the breach separately. What's wrong with this picture? Prior to deploying ransomware, the hackers stole the fundraising and donor databases of many of his clients, which included information such as names, contact information, dates of birth, and some clinical information. Remember the 3-star covered entities from the previous slide? Well, they were victims of this breach. Trinity Health, 3.3 million records. Inova Health System, 1 million records. And Northern Light Health Foundation, 657.4 thousand records. This particular breach is almost half of the records that were breached for the totality of 2020. Next slide, please.
Okay,
Polling
we're going
question. All right. Do you know what your top cybersecurity risk management activities are?
Okay, we're just about there. I'm going to close the poll, share the results.
It's good to hear.
Yeah.
Great. Thank you.
Okay.
Next slide, please. Go up one, Jerry.
Sure.
Okay, that one right there. Thank you. Nope. Come back to it.
Right there.
There we go.
Yeah. Okay.
Develop a focused risk management regime targeting at least 5 key cybersecurity threats and vulnerabilities that will help you in safeguarding your regulated information or data. Implement preventative, detective, and corrective controls that can either eliminate or mitigate potential unauthorized access to your data. The top 10 recommended cybersecurity practice segments should be your starting point in your information security assurance program. Remember, cybersecurity is an ongoing process. Today, your organizational risk posture may be low, nothing to worry about. Tomorrow, it can spike up to critical mass. Systems are being attacked without warning. Based on the rapid changes in technological capabilities in the cyber world activities around us. Next slide, please.
Okay.
Okay, thank you.
Yep.
Let's look at the data breach numbers reported over time in these charts for a minute. It's probably going to be a challenge for your eyes, but let's go through it. There's 642 reported data breaches since 2009, and that number has doubled since 2014. 29.2 million records were exposed in these data breaches, which was a significant drop from the prior year, 2019. It's just amazing, these breaches. But these slides pretty much show the trend, especially the top slide in terms of the number of breaches. The bottom slide where it shows red, it's interesting. There are stories behind every year, but this is not for this discussion. Let's move to the next slide, Jerry.
You got it, Bob?
Let's review, yeah, thank you. Let's review the underlying story behind the 2020 healthcare data breaches. Hacking and IT incidences accounted for 66.8% of the incidents and 92% of all breach records. That's big. Unauthorized access and disclosure of incidences accounted for 22.2% of the incidents and 2.7% of all breach records. At least 560 healthcare facilities in the United States were affected by ransomware attacks in 2020 across 80 separate incidences. That's a lot. Email, take note, and network servers accounted for 70% of the breached healthcare data. Email and network servers. with email, obviously, only coming in second to network servers. Did you know that 94% of malware is delivered via email? It's a tidbit you should take home. The end user is still considered the primary weakest link in cybersecurity, social engineering circles. Bottom line, weakest link. Let's move on to the next slide. There's more to this story. Here's how the story ends for healthcare 2020. The total number of reported data breaches increased by 36%, from 270 in the first half of the year to 366 in the second half of the year. The total number of individual patient records breached tripled in the second half of the year, from 7.7 million to 21.3 million. And of the 21.3 million records breached in the second half of the year, 97% were attributed to malicious hacking incidences rather than other causes. What you need to remember from this story is that 75% of all breach records in the second half of the year were tied to business associates and other third parties, rather than healthcare providers, health plans, or healthcare clearinghouses. This is why I'm doing this today, because we have an ongoing problem and we need to solve it quickly. Next slide, please. The wrath of COVID-19 has not only targeted world humanity by imparting a virus so strong upon us that it has taken countless lives in its path. And if that was not enough, it swiftly provided opportunities for the dark web, cyber criminals, to capitalize on our vulnerable situation by attacking our supply chain dependencies and our own healthcare systems with malware so malicious that it has caused extreme financial losses, along with destroying brand loyalty for some organizations. We need to face the reality that cybercrime is up by 600% due to the COVID-19 pandemic. Now is a good time to protect ourselves from the outside world, and it starts with a trust but verify third-party risk management program. Next slide, please. We truly operate in a web of webs, in that our third parties may have their own third parties, whether small, medium, large organizations they're affiliated with. It doesn't make any difference. We all have vulnerability gaps related to our people, our processes, and technologies, and each organization decides on how much risk they are willing to accept within each gap. Our weakest link in cybersecurity is the human factor within our organizations or in dealing with our third-party organizations. Next slide, please.
Okay, next poll.
Do you know who your weakest third-party links are?
Okay, looks like the results are in.
Very good. Okay, next slide, Jerry.
Okay.
Okay, perfect. I'd like to share with you today how we started the process of understanding third-party risks a few years ago. We are continually improving our methods and streamlining our workflow. It's an ongoing process. Nothing is perfect. Let's start with step one. Identify your third party. If you don't already know who your third parties are, then reach out to your accounts payable team or your legal or contracts team to obtain a list of vendors. And finally, confirm with the business partners if a security risk assessment is necessary based on data flow and relative importance to the organization. Step 2, categorize your third party according to risk. Will the third party process, store, access, or transmit regulated sensitive data? Where will the service and/or access be performed? On-premise, at vendor location, or a combination of multiple locations? What is the concentration of risk using the third party? Is it a sole source and you have no other alternatives? Relatively new in the activity space, they're financially troubled, has previously been breached. Step 3, develop or choose a cybersecurity assessment. This one's tough, all right? But I'll provide you with some guidance. Choose a cybersecurity commonly leveraged best practice standard. Identify key controls and control-based questions that are going to provide you with real value to your organization. Consider reviewing NIST, CSF, PCI DSS, or ISO 27001 or 27002 as guides for building your questionnaire, or reach out to reputable solution providers that know and understand the healthcare space. They can quickly assist and guide you in the process. Step 4, conduct assessments. Start with a plan, establish expectations, set appropriate timelines with a start and finish date for your questionnaire completion. Evidence gathering, risk identification, report release and remediation, and follow through. Ensure that the third parties agree on the scope of the assessment. Keep this last piece in mind. Always push for the right to audit. Step 5, address identified risks. Upon completion of your assessment, the review of the completed questionnaire and any supplied documentation as evidence supporting the questionnaires responses, the next step is to pull it all together in a report detailing any third-party security gaps that you find. To establish security controls outlined in the questionnaire, the risk appetite of the organization, coupled with the scope of the assessment and sensitivity of the data, may dictate the risk treatment, be it acceptance, avoidance, transference, and/or reduction, or remediation may be required before the vendor will be engaged with you. Last step, step 6. This is truly everything up to this point is important, but this last piece is probably the key to making this thing work. Step 6 is continuously monitor your third party. As long as the relationship remains intact, third party risk is not going away. Services expand or decrease. Third parties may make material changes to their locations or facilities. These are all reasons to continuously or periodically monitor your third party cyber risk. Re-reviewing the risk associated with the third party or continual monitoring of the third party relationships, controls, and activities are vital for meeting regulatory and compliance requirements for the health of the relationship and the safekeeping of patient information. I know it's a lot, but this is a simple starting point. And basically, when you look at the matrix and the chart on the right-hand side where I give examples, it should provide you with ample guidance in terms of putting something together. Ideally, the key is find some kind of a standard in terms of cybersecurity and pull those questions and put them together. Just keep in mind that there's so many of these things going out now by healthcare organizations and/or other organizations sending other organizations these types of things. I think they're all getting bogged down in the administrative process, but at the end of the day, it's got to be done. Next slide, please. Thank you, Jerry.
See you, Bob. Okay.
Yep. Okay, I had to catch my breath. Adopt an ongoing third-party security risk management approach that allows you to continually monitor and measure your riskiest third parties, that provides you with visibility using data-driven security performance ratings, and that can correlate the probability of a potential breach occurrence with your third party. Please focus on the top right-hand matrix entitled Probability of Data Breach. Companies with a security rating of 500 or lower are almost 4 times more likely to have a breach than those with a rating of 700 or more. Bottom line here, do you really want to do business with a third party that is classified with a basic security level score, anywhere between 250 to 640, as noted in the red highlights in this diagram? I sure hope not. Next slide, please. Know your strengths and weaknesses. Remember, it only takes one cyber incident to impact your organization's brand, whether it happens to you internally, within your organization, or externally through your third party. It makes no difference. Your patients have trusted you to safeguard and manage their information. Bottom line, you failed them, regardless of how you're going to try to spin the story in the public's eye. The key word for today is trust. It's a very powerful motivator, and that is why your patients keep coming back to you, and make no mistake about that. Trust but validate your business relationships. Moving forward from this day on, you can control the success or failure of your organizations. This completes this portion of the webinar, and I hope you find value with it. Thank you.
Okay, thanks, Bob. That was great. So Jason, I just want to mention, you can take all the time you need because we can go beyond 1 p.m. We can go all the way up to 1:15 if we have questions that we need to answer. Okay, so there's no problem, no need to rush. And here you go with your slides. And I'm going to bring you back to slide 1.
Okay, thanks,
full
Jerry.
screen.
And actually, Jerry,
There you go.
if you could please share the screen, that if it's possible to do that, or
You
control.
mean make you the presenter?
Yes, please.
Yeah, okay. Let me do that.
Great. Thank
Okay. Let's see here. Here we go.
You got it.
Should be able to take it now.
Okay, let me just, yep, almost there.
So right now, Jason, you're demonstrating all of the security you have to go through in order to display your screen, right?
Yes, I am. Yes, I am.
Okay.
And hopefully it went without a hitch, as if everyone can see the presentation.
Yeah.
And thank you, Jerry, and thank you, Bob, and thank you, Paul, for your presentations. They were very helpful. Third-party risk incredibly important. It was great, Paul, to hear about your experience during COVID-19 and really making changes at breakneck speed, which was very similar to the experience that I had as well. So hi everyone, my name is. I'm sorry. Go ahead. Hi everyone, my name is Jason Tahaney. I'm the Director of Technology here at Community Options. A little bit about Community Options. We're a nationally based nonprofit organization based out of Princeton, New Jersey. We incorporated in 1989 by our founder and CEO, Robert Stack. We help people with disabilities. And we do that by providing housing and employment supports. We've got about 5,400 employees. We're in 600 plus residential homes. We provide various day supports, activity-based programs, and more. Quick check, can everybody hear me okay? Jerry, am I coming across okay audio-wise?
There seems to be a little bit of feedback, but I don't know where it's coming from. So you can just keep going.
All right. Great. Sorry about that. Okay. So what I'd like to talk about in this presentation, I think it's always, whenever we're talking about cybersecurity and providing an update, it's very important to really talk about the healthcare IT or the healthcare landscape and the complexities that it has. I'm going to touch on that. I'm going to talk a little bit about what some of the COVID-19 challenges, both kind of on the world stage and what we experienced. Provide an update on cybersecurity, some of the latest threats. Healthcare breaches, how are we doing, right? and then some future technology, right, that might help us in the future to protect ourselves and really improve our cybersecurity posture. So, does this kind of look like your organization, right? I mean, healthcare IT landscape today, we still have some legacy applications out there. Unfortunately, there's some data silos still, costs rising, have shrinking IT budgets, we're a regulatory environment, limited skills, especially when we talk about cybersecurity and training and building a team, right? Where do you find those resources? So, these are all challenges that play into, cybersecurity risk, right? So what are our risks and challenges here? So just talking about legacy applications, you may still have some applications, some EHRs that were built in the 90s. You just have these smaller, you may have some smaller homegrown systems. You're starting to move to the cloud, or maybe you've fully moved to the cloud, which is better for overall security, right? But has some challenges, especially if you have on-premise systems still, right? And you're in a hybrid situation where you have some things in the cloud and some things on-premise. Talk a little bit, healthcare breaches. Bob had mentioned, he had the slide, and he kind of showed, the last 12 months, and just to highlight that a little bit, about 34.4 million records, right, in the last 12 months. So the breaches really continue to rise, and unfortunately, some of those breaches are very large, some of those single breaches. With regulatory environment, with PCI, HIPAA, high tech, all those things still exist. We have the cybersecurity needs of the financial industry, right, but not necessarily with the same budget. Training, for sure, finding good talent is hard to do. Building those teams, building it into your IT organization. And of course, and then for our everyone who's using our employees, right, how to prepare your organization for risks that are constantly changing and evolving, and they truly are constantly changing and evolving, right? So COVID-19, right, the challenges, what did, kind of what was going on out there? We, for us, we had to provide additional IT infrastructure to support staff working from home. We had to do that very quickly, right? And then whenever we move, we're moving our cybersecurity systems, out of the organization in a sense, right? So, those computers that were once within our four walls that are taking advantage of the security that's built into our networks, our corporate networks, now you need to replicate that at home, right? So, some challenges there. Sometimes you had less and less security controls. We also, some new social engineering things that we're seeing. I mean, related to COVID-19, if everyone, kind of remembers the John Hopkins map, right, of the COVID infection rate. That was a big one that went around, and unfortunately, the bad guys have replicated that, and everyone's thinking of COVID, right? So click here, and before you know it, right, just some malware on your computer. So. Other interesting stat, I mean, I actually had not known this until doing a little research for this presentation, but Google reported about 18 million in a week, right? Daily malware and email scams, right? So that's how many, in 1 week during COVID, right? So really, unfortunately, the bad actors were really taking advantage of the situation. And for us in cybersecurity and IT, we had to respond to that. Video conferencing platforms, right? Who wasn't using Zoom or GoToMeeting or kind of pick your video conferencing platform here? I think pretty much the whole world moved to this, right? So obviously the bad guys go where there is the most opportunity, and unfortunately there were some attacks on video conferencing platforms, right? But those things got fixed pretty quickly, right? And we really, I think overall it was pretty amazing what we were able to do and transition everyone and really make work from home work. Some other things, I mean, things you wouldn't, sometimes they're out of mind, but so social engineering attacks, things, in particular on cell phones, right? So, what they call vishing, not phishing, but vishing. I mean, constantly there are FBI warnings about different things related to working from home in particular, right? So, tricking you into giving your passwords to get into corporate systems, right? VPN passwords and things like that. I mean, they were just running rampant. So some of the things that we did to secure our workforce, we implemented the strong endpoint security policy. So this is on our computers that went out to the homes, right? We reconfigured the security software we had, right, to better protect our employees when they were working from home, right? A home consumer network is very different from a corporate network. If you're talking about my home, I have everything from Alexa to Google Nest. Kind of pick your your Internet of Things type of device, right, that we've all grown accustomed to make life easier, right? So different, you got to think about that a little differently when you're trying to protect corporate devices when they go into the home, right? So that was a lot of, what we did there and fine-tuned our policies. Some other things, for us, we really are a cloud-first organization. I mean, all of our applications are, for the most part in the cloud, and we're also an Office 365 environment. So it was easier for us because we already had things like OneDrive and cloud storage. And the nice thing about, cloud technologies, you get the security is built in. I mean, you have to turn it on, of course, right? But you kind of get these things out of the box. So, those data loss prevention rules, right? The things from, preventing things like, emails from social security numbers going out, or, patient records, those kinds of things, catching those things before they leave your organization, also scanning for them in your documents, right? All things that were turned on, and it helped us greatly during COVID-19. We implemented, so this is just something, we did, and you'll see the polling question. I'm just kind of curious. I'm not going to spoil the polling question that's coming up, but, we did implement a new cloud phone system, and we also did implement a complete video conferencing solution, and we were able to, secure that. Because what we had was, we had Zoom. If everyone remembers, Zoom kind of provided their free version for a period of time where, you had about 45 minutes on a Zoom session, right? Which is great, but, for us to manage and take care of that in a corporate environment, you can't really implement policies, right? So we had, so we purchased Zoom Meet. We implemented secure policies, right, to help protect our workforce during COVID-19. We added two-factor authentication to our remote access solution. The great thing about that today, I mean, it's very, very easy to implement that, right? And I'm going to show signs of my age here, but the days of, if everyone remembers the old key fobs and, RSA security that generates a 6-digit code, and you had it on your keychain, and, a lot of challenges with that technology working. Now two-factor is popping up on your phone, right? It's an app on your phone. Sometimes it's click a button here to allow you to complete the login process after you put your password in, right? Or even sometimes implementing biometrics, if you're leveraging, facial recognition technology on your phone to log in, or your finger, right? All play very well into two-factor, and it's very easy today to use those technologies. So here's our polling question. So, the polling question that I have here is, wondering, did you move an application to the cloud or leverage an existing cloud technology during the COVID-19 pandemic?
Okay, looks like we are almost there. There we go.
Okay.
Close the poll, share the results.
Okay, great. So 43% yes. All right. Yeah. So
Yeah,
that's really interesting to me, because I think trying to combine two things there. How do we improve cybersecurity, and also how do we react? What do we do to make things better during an unexpected event like COVID-19, right? So it's just great to see that happened, and I think that I'm a firm believer that moving to the cloud really helps your cybersecurity posture, and it's great to see all these organizations that are here to answer this, that you're able to move to the cloud and really take advantage during a very difficult time. So, this is, are we getting any better, right? Are we just kind of spinning our wheels? And this is cybersecurity. How are, Bob talked about the breaches. I'm going to talk a little bit about that, how they kind of continue. I'm also going to try to talk a little bit, not get too technical in the weeds, but just to kind of touch on, a very important part of, what we need to do to protect, and we'll kind of get to that here coming up. So software vulnerabilities, right? And this is an update on how we're doing. So exploits. The exploits are the things that, after your security defenses in your corporate network, right? After the hackers kind of get through that, what's left, right? There has to be something in software, whether that's your health system, your application, or that's the Windows, right? There's something there that is vulnerable, right? So that's what an exploit is. And what on the next slide, I'm going to kind of show the way these software vulnerabilities have been going up and down over the years, and kind of where we're at. I'm also going to touch on the healthcare breaches again, and just lightly. I know this is covered by Bob, just to kind of really provide some insight on the top 3 breaches, which were as a result of ransomware. So talk a little bit about ransomware and what are some of the things we need to continue to do there to protect ourselves. And then, other things going on. There's a new risk framework out there. I don't know if everyone's aware, but HICP, the Health Industry Cybersecurity Practice, was signed into law earlier this year. it really is a simplified framework. It's based on the size of your organization. So if you're small, medium, or large, right? Different set of controls or things that you can do to protect your organization. It's very prescriptive. It tells you exactly what you need to do. And it's not overwhelming like a large framework like, say, NIST, right? Very difficult to kind of jump in and get started with NIST. There's just many controls, right? So HICP looks to be something that could really be useful. You can kind of think of it as a cookbook, right, with the top 10 controls, right, or the things you need to do to protect your organization against the top threats. So there's that alignment. They've kind of said, here are the top threats, and here's kind of what you need to do on the control side. So I think it's a very good thing. So talking back about those vulnerabilities and those exploits, right? So what we're looking at right here, this is a online website called Exploit Database, and what it does is it tracks the number of exploits or ways that people with malicious intent get into networks, right? And it's really an exploit typically uses what's a vulnerability. So we can kind of see this graph here, how things from 2001 was kind of quiet, and then we really between 2006 and 2011. I mean, just a lot of exploits, a lot of things going on, right? I mean, and then things kind of calmed down a little bit, working up to 2016, and then evened out. So, so we asked ourselves, are we getting any better? I'd like to think we are looking at this. Now, some of these highs and lows could be related to things like, new software being released. And then you typically, when you have a new software that comes out, you're typically going to have some vulnerabilities. But I do think, we're trending in the right direction. And this really just amounts to, how good are we at writing software, right? So, I mean, it's getting better. Yeah, and in particular in ransomware, we talk a lot, I know, we talk a lot about the human element and, clicking on a link in an email, which yes, those are the things that we need to continue to get better at and educate, our workforce. However, on the technology side, right? So they clicked on that link and then they're utilizing one of these exploits to continue the attack. We got to get better on the technology side, right? And I think there's some signs of that here by looking at this graph. And then this is, so I kind of saw this already, but I just wanted to just sort of point out here that there were, if you look at the top breaches here, and not using any names, but I mean the ones that were, over, 9 million, 4 million, 4 million ones, right? So they were due to a ransomware incident. So ransomware still continues to be a very big threat, and as I talked on the prior slide about those vulnerabilities or exploits, typically that's how ransomware, takes effect, right? I mean, it finds for flaws and it does its thing. It's typically, you're not necessarily a target, you're just sort of, these things are out there in the wild and they end up in your network, right? And then you have systems that are, not patched, right? And they have some vulnerabilities, and that's kind of how these things take off. So, and the other just comment here, I know it's we've been talking, we used to talk about 1 or 2 million records breached now, and now it's just not, that's the common thing, right? So, and with even more, 9, 4 million. So unfortunately, they kind of continue to go up. So there's definitely room for improvement here, but I am hopeful that we're going to get this thing kind of righted. And I guess if you look at it another way, over the last 12 months, and kind of what this article's speaking to is that the average has kind of stayed about the same for the smaller breaches, right? So we're kind of holding the line a little bit, but still, a lot of work to do there. So then we're on to our next polling question here. So what are the top cybersecurity threats that you are seeing at your organization? Is it A, email phishing? Is it B, ransomware? C, social engineering? And in particular, I'm curious to hear if you're getting some of those phone attacks, right? Those phishing phone attacks, and or is it all of the above?
Okay, I'm going to close the poll, show the results.
Okay, so email phishing, yep. Okay, Rick, way up there, followed by ransomware. Yeah, so those, that's pretty much in alignment. Top threats, not too much on the social engineering side. Okay, good to know. Thank you.
Okay.
And so just this is just sort of like to summarize a little bit what we talked about, but software vulnerabilities, I think they're statistically we're better. There are some higher impact vulnerabilities, so that's what that graph doesn't show. So those, we're talking about those exploits. There's just some ransomware in particular, some pretty bad ransomware that's been out there that's had a pretty severe impact. But overall, the exploits, are down or leveling out. You know, with everyone working from home, kind of like, you know, that network perimeter, right, has expanded, and it's just, there's, you know, it's when we talk about vulnerabilities, which, you know, are at the heart of all this, right? It's so you've expanded that out into your consumer, you know, work from home networks, right? And there's just things you got to do there, and I mean, there's plenty of technology, you know, I mean, that you can implement. You just got to turn these things on. But it does change the way you think about things, and you know, in terms of like how you're protecting employees and computers and assets, right? So ransomware, you know, like I've talked about a couple times already during this presentation, it's still very prominent threat, and we have to take it very seriously. So just this, you know, these are kind of like, you know, what do we need to continue to do better? You know, this is, and some of this falls into that IT hygiene. You know, what are we doing? You know, patching, and more patching. It is difficult in a healthcare environment for the reasons I spoke about, the complexity. You know, and there's just a lot of challenges there. You know, medical devices. You know, you have to have a process to patch them, right? It's not something, you know, especially, you know, we're talking about timing and when a patch comes out, when you can actually apply it to a system, right? Sometimes it just needs to be weeks, but the vast majority, you know, of how things get in, so talking about desktop computers, right, that are used every day, those are the things we got to continue to focus more on and keep those systems, you know, as current as possible. Cybersecurity awareness training, you know, always important. You know, it's that human element. We need to continue to do that. Email phishing and ransomware, you know, those two things do kind of for sure go hand in hand. You know, I mean, the phishing is how, you know, the ransomware gets in, and then once it's in, you know, how is a software vulnerability exploited so that the ransomware can do its thing, unfortunately, right? So, and then, you know, what are we doing to develop these cybersecurity teams? Either, you know, you're going to develop this in-house, or more than likely you want to leverage, you know, managed security services, right? It's some combination of having in-house and managed security, because there's just expertise that you can't have inside, you know, it's difficult for you to have in your organization. And I also believe, you know, cybersecurity is a part of your IT team. You know, it's got to be built in. You know, the same individuals that are, you know, maintaining your systems and whatnot, infrastructure, right? They need to know about cybersecurity. They need to be trained. It needs to be in your budget. You know, if it's not in your budget, there's just risk that, you know, you're not going to spend that money the way it needs to be spent, right? So you really got to allocate for it in your budget. And adopt a framework that works for you, and stick with it. You know, just it's almost, you know, don't be overwhelmed. Pick one. I spoke about HICP. I'm real excited about it because it is simplified, right? And it's based on the top threats. So, you know, you just kind of pick one and just kind of go with it. So are we making progress? Is it possible? You know, I think someday for sure. You know, I think there's just, you know, too much. You know, it's a huge issue for everyone, and you know, we're going to solve this thing, or get really close to solving it. And then on the next slide, I'm going to just touch a little bit on some of the future technologies that I see that might help us. And this is the part of the presentation that's getting a little geeky on the IT side, but you know, just for a little bit here, we're going to talk. You know, Zero Patch is a technology that allows you to patch systems. You know, we're talking about patching those vulnerabilities and those exploits. Allows you to do it without any downtime. So you don't have to take a computer system down, right? It does it in real time, which is, you know, very powerful, because many times especially in healthcare environments, you simply can't take systems down, right? They need to keep running so they can support, you know, those who are providing care, right? So, I mean, a lot of promise there. You know, I put, you know, blockchain in here, you know, and this is, you think about like Bitcoin and cryptocurrencies. If you're not familiar, this is the technology really behind it. And when we talk about Bitcoin, I mean, you're talking about hundreds of thousands of computers out there in the public internet that are attacked by hackers on a regular basis. Yet their blockchain technology stands up, right, and is able to hold up. I mean, there's been, you know, none of it's perfect. I mean, there's still some attacks, but you know, typically, you know, overall, it's been very promising technology. And you know, there's talk about how to use blockchain for other things other than cryptocurrency and Bitcoin, right? Things like verifying integrity of software, right? Do you trust that software you're installing, right? On the IT side, IT system configurations, you know, when we talk about change management and what, you know, as a result of change management, are we going to open up a cybersecurity issue? So, you know, using blockchain to kind of just verify the validity of your entire system configurations and be able to, you know, kind of have a good audit trail of what's changing, all promising technology. And that's just a very short list. There are people much smarter than me that are working on, you know, blockchain for cybersecurity, and I think we're gonna get there with it. So No password technology. This is just something we haven't talked about passwords, but I think everyone kind of knows these are the weakest link. Microsoft has a very nice product called the Microsoft Authenticator, and they're looking to really eliminate passwords. And you may think, well, how are we going to eliminate passwords? Well, it's, it uses biometrics, it uses your fingerprint or your facial recognition, right? In place of your password, right? To log you into many systems. It's supported on all of Microsoft's products. If you're an Office 365 customer, you're able to take advantage of that. And there's also many other vendors who are using that. So, all right. So I think we can. It's safe to say, healthcare has some unique challenges. I'm going on the next slide. I'm going to have a quote here from Michael Porter, who is a American academic, and he's really known best for his theories on economics. He's written a couple books on business strategy, and he said strategy is about making choices and trade-offs. It's about deliberately choosing to be different. I think this truly does apply to cybersecurity. I mean, we kind of have to think about this differently. And when you talk about cybersecurity strategy, you're making decisions that are not going to be popular. So it is about trade-offs, and you do kind of have to deliberately choose to be different, right? And hopefully do that with minimal impact to kind of the operations and keeping things running. Of course, that's the best security if it can be behind the scenes and it just kind of works. But I thought this was a good quote and want to share with everyone. And we'll run through. And then, so just some of the key takeaways here. The risks continue to increase, but I do think there's hope. We're making progress. IT hygiene, the way you manage and take care of your systems, your IT systems, still very important. And that's the basics, right? There's still many things that happen out there because, sometimes the basics are not being done, right? So you have to kind of keep that up. Healthcare for sure is complex. That makes it more difficult to protect and to come up with cybersecurity risk strategies, but doable, right? Anywhere we can simplify healthcare system, goes a long way. Impact of unexpected events I put here. COVID-19, what that kind of did. I mean, it really forced us to move at a very rapid pace, and how cybersecurity is impacted by that. I think we learned a lot, and I think we'll be ready for the next time around, right? And I think there's because we gotta, you're talking about making changes, and that's kind of the part that are you going to introduce new risk into the organization? You got to do it safely, right? We learned that. So help is on the way. Future tech, some of the things that we talked about. I think there's some good things out there that we're going to see soon, and hopefully we'll make some progress here. So that's about what I had, everybody. I don't know if anybody had any questions, but here's my contact information, and these are some of the references, some of the things we talked about.
Okay, Jason, thank you very much. 3 excellent presentations. We do have a question that came in, and it's, can the panel speak to their concerns or potential added risk of using offshore vendors from a cybersecurity liability risk? What questions are necessary to ask when vetting these vendors? So any one of you can take that, and more than one, if you like.
Well, I think you have to kind of treat them, I don't want to say the same, but at a base level, you got to treat them the same, like, it's a third party, and the things, the things you're doing to manage third party risk. I think I think either way, you're potentially introducing some risk there, just, because I mean, but it's not, I don't know, is it different than adding another vendor? Possibly, but that's about what I would say. I mean, you really got maybe you got to treat them a little bit more stringent, right? Really keep up on managing that the third party risk part of that.
So Bob, any comments on that?
Yeah, my big concern in anything outside the barrier of the United States of America is, where is my data going to reside? It better be stateside. If it's going to be any place in the cloud, housed any place outside of the United States, that's a fundamental problem with me, because legally, how do I get my data back if something goes awry? All right. So at least I have the court systems in the United States to protect me. Outside of the United States, I have nothing. So that's my primary, we'll say, concern. Other concerns are more, in what country are they operating out of? And the only reason why I ask that is that, well, I'll share with you. I block over 250 countries. whether it's on our email system or firewall. And I want to know what country they're dealing with, because if you would actually have the systems in place to look at what's coming into your organization for emails, I think you probably want to start blocking things as well, because a lot of it is phishing attempts, targeted solicitations, and so on and so forth. But so those are the two things. Think about legal. How do you get your data back, or how do you protect your data if this third party that operates in some obscure location in the world starts sharing your data someplace else? And then the piece with the country in terms of, is there any internal turmoil going on, and activity that has to do with the dark web.
Okay, great. Paul, did you have a comment on that? I think you're on mute. Yeah, you're definitely on mute. Okay, so what I'll do is I'm going to present a question to Jason. So Jason, if you could recommend one thing to reduce your overall cybersecurity risk, what would it be? One thing.
Yeah, I mean, the one thing is, in line with the top threat. I mean, it really is email protection. What are the technologies you're putting in place there? And you kind of think about email. Email kind of is email, but it does change. And there are, improvements in how you can protect email, and really having someone look at your email on a regular basis, review how you're set up from a security standpoint. Because I mean, as we know, the malware and those phishing attempts are coming right in through email. It can be an open door into your organization if you're not protecting it and doing the things that you need to be doing there. So I would probably say your strategy around securing your email and the technologies you're using to do that.
Okay, thank you. Paul, I think we have you back, right?
I don't know. Can you hear me?
Yeah, I can hear
Oh,
you.
okay. Something happened. I don't know what. Anyway, what Bob said before is I agree with him 100%. Keep your data in the United States so you can use the court system to get it back. The other thing is obviously the basics. Check the references of any company that you're going to try to use. Very important.
So Paul, post-pandemic, do you anticipate to continue the need to support a remote workforce?
Absolutely. We've already went through the process. Our finance department, for the most part, is going to be a remote workforce. Our call center is going to be remote. IT is going to be hybrid. And a couple of our other departments as well will be hybrid. We're actually reconfiguring our corporate headquarters to get rid of certain cubicles because we're not going to need them. And it's going to be a hybrid solution for the rest of my company. And what I'm reading in New York City, many of the corporations are having to deal with remote workforces that don't want to come back. In the Wall Street sector companies as well. Some of them are moving out of the state. They're moving to Florida.
Okay, thank you. So we're coming up on almost 10 minutes after 1, and I think we had a great session today. Some good questions. Thank you, Cheryl, the one who came in with that question, the first one. And what I think would be great is to continue this kind of thing and get into a little more into the area of HICP that Jason mentioned, and even into the area of DRBC, disaster recovery, business continuity. We have seen some large health systems that have been brought down by ransomware for 30 days or more. And a lot of times DRBC plans will cover up to 72 hours for the criticality systems. So now they're looking, hospitals are, they have to look at what happens if you go beyond 72 hours and what happens if you go to 30 days. There's a lot of business side of decisions besides technology. So it might be, for a future webinar, those things. We also have a survey going out right after the webinar, right after we shut this down. Everyone will have a survey, and I want to thank NJHFMA for allowing us to present today. And I want to thank Jason and Bob and Paul for bringing together a great presentation. Luckily, it's been recorded. There's been so much good information here that I'm sure a lot of people are going to want to share it and play it back and listen to it. There's a lot of details. So the PDF will be available and the recording link will become available. And look for a future, hopefully a future NJHFMA webinar with the experts. So thanks, everyone. Have a great day.
Thank you, everybody. Take care.
Thank you, everybody. Take care.
Bye-bye.